Hi, I'm Dr. Neeraj Saraf. I'm Director of Hepatology and Liver Transplantation at Medanta Hospital in Gurgaon, Delhi, NCR. And it's my privilege to welcome Dr. MacCaughan from Sydney, Australia to the Asian Pacific Digestive Week, which is being held in Kolkata this year.
Neeraj, it's a pleasure to be here. I'm a liver physician and hepatologist. Like Neeraj, I direct the Australian National Liver Transplant Unit in Sydney and have been in practice in liver transplantation for over 30 years.
So Jeff, I would like to start on asking you how has liver transplant evolved in the last couple of decades in Australia? And I would like to ask you to make a specific comment on organ donation, because that seems to be a major problem in our country and we're not able to get disease donor liver transplantation going as much as we would like.
Yes, Neeraj, it's been a great challenge in Australia. So up until 10 years ago, we had organ donation rates between 8 and 10 per million for deceased donor. Transplantation was slow. We weren't doing as many transplants as we wanted. We had deaths on the waiting list. And a group of us asked the question 10 years ago, why is that the case? And I'd always assumed that it was due to families refusing organ donation. And we did a study where we took the Spanish data, which were at that time had organ donation rates of over 30 per million, and essentially 300 times more than 300% more than we had, and then modelled our organ donation system on their organ donation system, and in terms of consent and then utilisation of donors. And we found that there wasn't that much difference, and that the big difference was the identification in intensive care units of potential organ donation donors. So it had nothing to do with community attitudes. It had nothing to do with community drives or advertising to become a donor or registration on donor cards or anything like that. It became apparent that the Spanish system was a hospital system that was developed through a national process that drove the identification and funded organ donation coordinators within major hospitals. And then they were able to, and then they were separate to the intensive care doctors that were looking after the patients. And we went to Spain, some of us, and we modelled that and brought it back to Australia. And we were able to get the federal government to invest a large amount of money across Australia in positions in intensive care units for specific organ donor coordinators and intensive care doctors who at least 50% of their job was the identification of organ donors. And that's made a huge difference. It's increased organ donation from 10 per million to 20 per million. I think we can do better. So it's an organisation and an attitudinal culture within hospitals rather than a cultural issue in the community. And that's what the other countries have told us who have much higher organ donation rates than we had and still have. And I think it's a challenge for countries like India to realise that this is a systemic problem in their health system. Clearly, India has a great record in actually doing liver transplants. The results are fantastic.
Right.
The physicians and the surgeons are fantastic and world class. So I can't see any reason that if you were able to develop that side of the medical thing, why there seems to be a resistance to try to get going the other side of the system, which is a medical system. There are a lot of barriers, and we could discuss that, but I was wondering what you thought about whether there are systems that people are trying to develop systems, or whether there's any activity at all about developing systematic approaches to identification of potential organ donors in intensive care units.
Yeah, so liver transplant in India has predominantly grown as a living donor liver transplant program. And to be honest, probably not a lot of effort was made in the initial years because living donor was doing well, and but now I think a lot of in the southern parts of India, organ donation rates have picked up significantly. A lot of efforts are being made at individual levels, and like you said, at hospital levels, at neuro ICU levels, and the right legislations have been adopted by government. So I think it's picking up. The northern part of India is still lacking, is lagging behind, but I think we'll get there. And I heard you saying that this is a systemic problem in this country, and I totally agree. And so, you have any tips for us specifically?
I think the major thing is to get intensive care doctors not to be afraid of organ donation. It is a difficult subject. It involves death. It involves handing over, if you like, the patient that you've looked after who's now died in your intensive care unit to another team, if you like, that will then take the organ donation process, interact with the family, and be responsible for getting the organ donation done. And we found that there was a lot of resistance culturally within our intensive care units to that whole concept. So it requires a bit of a gentle approach, but a pretty firm approach that this should happen. It needs resources, which would probably have to come through governments and hospitals, but we know the cost benefits of transplantation. I mean, we know, particularly in renal transplantation, to keep people on dialysis not only is associated with major mortality, which is much higher than kidney transplant, the costs of doing a kidney transplant and getting done one successfully are 20% that of maintaining people on dialysis.
That's right.
So the economic costs of getting this right.
Plus, you can't really maintain the liver patients too long on.
And you can't maintain the liver patients too long. So the economic argument is strong. The social economic argument is strong, but there will be barriers. I think largely medical cultural barriers, unfortunately, to try to get these systems right. And the Spanish have overcome it, the Norwegians have overcome it, parts of North America have overcome it, other parts of Europe have overcome it. There's no reason for India to overcome it. I don't think it's a religious issue in India. It's more of an organizational issue in the hospital system.
Yeah, I think so. So I think we are. I think we are doing very well in terms of living donor transplantations. We've got large numbers. We've got good experience. Like you said, we have excellent surgeons and teams, and we've got very good results. And so hopefully, with disease donor liver transplantation picking up, I think the pressure from living donor transplant can be eased off a little, and I think that'll be.
Well, you can
that's
also.
That's the way to go forward.
They're not mutually exclusive programs, so you can actually deliver transplant. If you get deceased donation right or get on the right track, you can start to offer more patients transplantation, which would be fantastic.
Okay, thanks a lot, Jeff. It's been great talking to you.
Okay.
And hopefully I'll give you more positive news next time.
Okay, I've enjoyed the discussion. I've enjoyed being here in Calcutta.
Okay.
Thank you very much.